I'm Dr. Tom Babu, and I'm the consultant endocrinologist at Silverline Hospital, Kochi. Today, we will talk about the role of exercise in managing diabetic patients. Exercise is a cornerstone for diabetes management. The others are diet, drugs or insulin, and the testing of the condition, means the blood sugar, the blood sugar values, or the A1Cs that we do. We test for cholesterols also in these patients, etc., etc., renal functions. So all these form integral parts of diabetes management. But if you ask me, two main factors or two main indices in the management of diabetes is, one is diet and the other is exercise. I'm not taking away anything from the medication or the diagnostic part of it. However, those two fade away in front of the importance of diet and exercise. So let's pick on exercise to start off with. So exercise is so important because what happens fundamentally when a diabetic patient exercises is that there are glucose transporters in the cells of all of us have glucose transporters, and glucose transporters do not require insulin for its action. So when somebody has food, obviously the glucose in the blood starts to go up, but in non-diabetic patients it remains in a range. In diabetic patients it goes beyond a range. It can go to any level. So once that happens, the glucose has to be cleared up into the cells for several processes that go on, and this is what gives energy to these cells. So if that has to happen, the body requires insulin, and in diabetic patients there is either too little or it doesn't act. And so the amazing thing about exercise is that even without insulin, the glucose can still be taken up by cells for its important processes or metabolism and as a whole, and therefore it becomes a very smart and effective way to clear up this glucose into the cells. So therefore the blood levels of glucose come down, the cells get enough of glucose, which is otherwise much needed energy, or the nutrient that the cell needs a lot, without which the cells cannot survive, and it's hunky-dory. So it's all a happy story. If the diabetic can exercise nicely, the glucose gets cleared up, and the body can metabolize glucose very well, which does not happen in diabetic patients. So that's how important exercise is.